Hello and welcome back. Um, so today I want us to look at second trimester danger signs. And before we proceed, I want us to hear some words of wisdom from Proverbs chapter 31, verse 30. The Bible says, "Charm is deceitful and beauty is vain, but a woman who fears the Lord is to be praised." Now, if you're new here, please consider subscribing to our YouTube channel, Doctor on Wheels, and also in our social media platforms, that is Zawadi Premier Hospital underscore Ngong for Instagram and Zawadi Premier Hospital Ngong for our Facebook page. So let us dive into today's topic. So, second trimester danger signs. So number one by far is vaginal bleeding, and we explained it in details in our previous video, especially on our first trimester danger signs. So bleeding can be as a result of signs of miscarriage, that the pregnancy is coming out, and therefore you need to be aware of that and basically seek medical attention as fast as possible. Now, other causes that can cause as well bleeding is something called placenta previa. Now, placenta previa is basically just a low-lying placenta. Okay, so when you look at the uterus, okay, at the top, which we call the fundus of the uterus, is where we have the bulky of the muscles, and that most of the time is where the placenta attaches itself. Now, sometimes you can have the placenta attaching near where the cervix is, and if it attaches near where the cervix is, where the muscles are not very bulky, it means then it's easier for it to be able to detach, okay? And then, as well as sometimes because of vigorous sexual activity, you can easily disrupt it, and that one can cause bleeding. Okay, so an early ultrasound is very important, especially the first trimester ultrasound. It helps to determine exactly where the placenta is, because management of someone who has placenta previa and someone who has placenta at the fundus is different. And then placenta abruptio as well, which basically it's detachment of the placenta, which can actually lead to miscarriage. We have already looked at that in detail. And then, of course, urinary tract infection can as well cause vaginal bleeding. Now, the second danger sign you need to be aware about is still abdominal pain, and abdominal pain can be as a result of urinary tract infection, pelvic inflammatory disease. Um, of course, with placenta previa, still you will still have abdominal pain. We talked about ovarian torsion in the previous video. So those are some of the things you need to be aware about. And then here, the third danger sign you need to be aware about is severe headache, blurring of vision, and then swelling of the face, or what we call facial puffiness, or even the hands, swelling of the hands, swelling of the foot. And that one might be the early sign that you can see for preeclampsia. Now, preeclampsia is onset of high blood pressure after 20 weeks of gestation or after 20 weeks of pregnancy. So, the one of the things that is feared, especially with preeclampsia, is something we call the HELP syndrome. So HELP syndrome is basically where you have your red blood cells starts to break down or burst, what we call hemolysis. So if your red blood cell starts to break down and hemolyze, it means then you will end up with anemia. And then the second thing is you have elevated liver enzymes. So the liver is also attacked. So then you have elevated liver enzymes. And if care is not taken, basically you will end up with a bad liver. And then the last thing is reduced number of platelets. So the platelet count basically goes down. So what happens if you have your platelets going down? It means that in case of any bleeding, okay, you will bleed a lot, okay, because your platelet count is very low, and therefore this is what we need to really prevent, especially with preeclampsia. And also, you see, now the HELP syndrome can actually lead to now the eclampsia, which is convulsions, loss of consciousness, seizures. And with that, with convulsions and all that, it means that the baby will not receive enough oxygen, the baby will not receive enough nutrients, so therefore you will end up with what we call placental insufficiency. Now, placental insufficiency can actually lead to that baby inside that womb to actually go into distress. And if care is not given in good time, we might end up with a demise or a fetal demise, or basically the baby might die in the womb. So one thing that leads to another, that leads to another. So anytime you start seeing facial headache, blurring of vision, facial puffiness, or periorbital swelling, okay, swelling of the hand, swelling of the foot, do not wait at home. Please go to the hospital. You will be evaluated and you will be started on some medication if the swelling is caused by the high blood pressure, and you should be able to be okay, and so that you are able to get the baby to term. Another danger sign that you need to be aware about is, which we had already looked at, is hotness of body, or what we call increased temperature, chills, height, and fevers. And that one is indicative of infection, mostly urinary tract infection, especially the upper urinary tract infection like pyelonephritis, and then infections like malaria, infections like chorioamnionitis can also lead to increased temperatures. Now, the other danger sign that you need to be aware about is leakage of fluids through the vagina, or what we call drainage of liquor. Now, drainage of liquor basically means that the membranes that are covering the baby have had there is a break in that membrane, and if the membrane breaks, it means that the water that is covering the baby, okay, what we call amniotic fluid, will start leaking out. Okay, so when it starts to leak out, it means then the fluid that might remain will be very little. Okay, and if it's very little, it means then the baby will not have enough fluid for growth. Okay, so the baby will be compressed. Okay, and that can easily lead to either the baby leading to distress. If you have very little amniotic fluid for quite a long time, it can also lead to some congenital anomalies, and sometimes you can even lose that baby. Now, what can cause fluid to leak? So the major cause is infection, especially chorioamnionitis. Okay, urinary tract infection can also cause that. Okay, so you need to be aware of that, what we call premature rupture of membranes. So if the membranes rupture before, especially before 37 completed weeks, that is premature rupture of those fetal membranes, and it is a danger sign you need to be aware about, and you need to seek medical attention as soon as possible. Then the other thing is pain when you pass urine. We have already discussed that in details in our previous videos. Mostly it's caused by infection, and then convulsions as a result, or fits as a result of increased or high temperature, high blood pressure during pregnancy that it has not been well controlled, and therefore you end up with convulsions. Now, you need also to be aware about signs of anemia. So how will patients present with signs of anemia? So basically, when you look at their hands, the hands will be very pale, okay? And then they will also complain about general body weakness. Okay, so easily fatigued, they will also complain, and they will also come with dizziness. Okay, sometimes blurring of vision. Okay, so you need to be aware of those signs, and if anything happens, you need to come to the hospital. So sometimes we end up, especially if there is the anemia is severe, we will have to be transfused, okay? Because anemia has an effect both to the mother and both to the baby. So both to the mother and the baby, so therefore it's good for you to be aware about that. And then the other thing is persistence in vomiting, nausea. We talked about hyperemesis gravidarum. You can refer to our previous videos. Okay, so that is something that you need to be aware about. And finally, you need to be aware of signs of deep venous thrombosis. So what is deep venous thrombosis? This is where blood basically clots, especially in your veins in the lower limb or the lower leg veins. Okay, so pregnancy in itself is what we call, quotes in quotes, a hypercoagulable state. So your blood will not be returning to the heart the same way, or the movement of the blood might be a little bit slower. So if it becomes a little bit slower, blood, when it doesn't move, it clots. Okay, so pregnancy itself basically can cause that. The second thing is positioning. Okay, so when you basically at night when you sleep, okay, you have to be very careful on how you lie. So then you don't lie on your back, because that way the weight of that baby can actually press on that vein that brings blood back to the heart. So if it presses, it means then the rate at which the blood is being brought back to the heart will reduce. And in that process, if it reduces, it means the blood can easily clot down where the movement is not in the right speed. So you need to be aware about that. So how do patients present? They will present with painful lower limb swelling. Okay, so there will be swelling of the lower limb. Okay, it can be either one side or both sides, and then there will be swelling, and that swelling there will also be redness, and then when you touch, you will feel the affected leg is much more warmer than the other leg. So those are the danger signs that you need to be aware about, especially in second trimester. Now, if you're new here, please consider subscribing to our YouTube channel, Doctor on Wheels, and turn the notification button so that you're able to be updated every time we upload a new video. You can also visit us at our hospital, that is our Premier Hospital. We are located at Lubsil Center, opposite Yuango Petrol Station, ground floor, that is in Ngong Town. Otherwise, God bless you until we meet next time.